Good evening and thank you for inviting me this evening. I'm Marlene Quinn. I'm the Cabinet Member in St Helens for Adult Health and Social Care. I've been asked to come along to share some thoughts and experiences that I've witnessed in St Helens during the pandemic and what we've learned and shared across the city region. First of all, in St Helens, probably we were better prepared than a lot, because in St Helens we are integrated with our adult health and social care with our hospital trusts, Whiston and St Helens, and with our CCG. And we've been on that journey for quite about 3-4 years. In fact, I came and spoke about our integration quite a few months ago here. So we were better prepared than some, but believe you me, nothing could have prepared us for what came. Obviously, our integration, we had our police partners with us, and we had fire service, probation, all the organisations there. So all the challenges that have come through the pandemic, and yes, adult social care, but children's social care, family care, we were able to tap in to our People's Board, where all these professional organisations sit around the table and we work together for the place, and the place is St Helens. Obviously, we've had domestic violence, domestic abuse, and we've been able, through our housing partnership with Taurus, to relocate females and males into new housing, to get them into a safe place. We had challenges with children not going to school, so our partners, along with schools, were going out, approaching all the homes of these children, ensuring that there was no safeguarding issues or our vulnerable children, because even though vulnerable children were a priority in places in schools, quite a lot of them didn't take them up. So that put that added pressure on the services. On top of that, within St Helens, we have an ageing, sick, chronically sick population. It does go back to our industrial heritage, and we have quite a lot of severe disabilities coming through from our children's services into adult services. Obviously, all day centres were closed, so what was seen as the norm for our residents that went to Kershaw, which is quite near Mary's, and it's for our sufferers of dementia. We usually have about 50 people a day in that centre, 5 days a week. That had to stop. We have Stevenson's House, which is facing Whiston Hospital, and that is where our severe learning disabilities go for the day and get forms of therapy, friendship, integration and care. And that is to relieve the carers in both settings. That had to stop. All our sick people out in the community who thankfully enjoy independence with family carers or organisations, quite a lot that engaged with commission services, domiciliary cares, were very frightened and wouldn't let the provider of care and support in the household. And that was an added pressure, because you had to ensure that if it was a district nurse going in that was treating bed sores or ulcers, that those dressings were being done, that no one was being ill-treated or neglected. So the pressures have been immense out there. Then we had our learning disabilities in the community that go to engage with direct payments in day services. They choose which service they want to go to, and they buy into it with public funds. All those things had to stop. So if you think of all the things that stopped, it put the pressure in the homes on the carers. And we have some very, very elderly carers in St Helens. And irrespective of age, to have to provide care 24/7 for learning disabilities, dementia, if they're bedridden, there was no carers relief, so they had to stay in the home. I'm sure you'll appreciate those pressures and the extra strains that was put on local government to ensure that safeguarding was really, really strong and emphasised, that care was being delivered to our most vulnerable in the best way possible, and that anybody that was facing abuse, domestic violence, drug addiction, whatever, had somewhere to go to ring. So St Helens set up St Helens Together. St Helens Together came about as a sideline to Contact Care's, and they actually used Contact Care's phone number. And we raised £85,000 from the community, and that was to make food hampers up. The government sent food hampers, but mark my words, anybody who saw them would tell you what was in them. There wasn't nutritional foods, there wasn't the right quantities, there wasn't anything if you was diabetic or if you had a wheat allergy or whatever. So we had a big school warehouse where the army supplies was dropped. Our £85,000 added to that, and we made up those hampers with the foods that were needed. We also fed the families of people that were immediately hit with financial issues. So it was a massive challenge for everyone. And I've got to say, a challenge for public services. Our carers will never be able to thank them enough. We really do owe a debt of gratitude to our carers. Our volunteers, they may have been furloughed from the company, they came and volunteered. We had, through the voluntary sector, a shopping rota and a line that all the people that needed shopping just phoned in. It was put on a computer system. Whoever could pick it up and go out. And that it continues today and will continue. So it's been really, really busy. The care homes, and probably, I don't make any apologies for getting emotional here, because it's really told of me. I took it personal because I knew how hard we had worked with our care homes, and I knew we was in better place than a lot. We have excellent relationships with our care homes, absolutely excellent. But we had 1,203 people in our care homes at the beginning of COVID. And straight away, obviously, we knew that some were going to the hospital and being tested at the hospital. And then government came out and said, no, all these old people have to go back to the homes, no testing for them or anything. What I can say is that even before government came out and other political parties to government challenged, we'd already got a system in place, and that was through our contact cares, no unsafe discharges from hospital took place to our care homes. That doesn't mean to say that everyone was tested, but what it does say is there was no one discharged that was needing medical help. We didn't put any pressure on any of our care homes to take anyone that had COVID symptoms. We didn't pay additional money for them. And that was the relationship we had with our homes, that they knew we were there for them and wouldn't desert them. None of our care homes went without PPE at all. And that was our partnership. We begged, we borrowed, we stole, all between us, but not one of our care homes went without PPE. We had a team meeting with officers, and that took place every day with our care homes to find out what challenges there was, what symptoms there was, what they needed, everything you can think of. Once a week, we had a complete join-up where every home could come in together and share best practice, share their thoughts, share their anxieties, everything. We actually asked our homes to stop the visiting prior to lockdown and prior to government requesting it. And that worked in our favour as well. So in many, many ways, we were on a better foot, but we still had our deaths. Out of the 1,203 residents and family members in our homes, with COVID, up to this Sunday, we had lost 76 people directly linked with COVID, COVID, number 1 death certificate. In total, we've lost 259 residents, but quite a lot of those were, sadly, they would have passed anyway, or COVID might have been an attributor to their final death, but it wasn't number 1 on the death certificate, or wasn't on the death certificate at all. Currently, and over the last 5 weeks, we've not had 1 death COVID related in any of our care homes. We've not had any tests positive or symptomatic in the last 5 weeks in our care homes. And that goes for our service users and our staff. They're not our staff, they're out there in the community. They're employed by the organisations who provide the homes and we commission. So on the whole, I think you'll appreciate, doesn't take it away, that when you hear these figures, 50% and 40% throughout the country in care homes, and you think we had 1,203 residents, we know 76 died of COVID in those homes. That's about 6-7%. I think someone was looking over us and spurring us on. I genuinely do have faith, but I think without a shadow of a doubt, the relationship and the partnership working and the trust that the care homes placed in us and we placed in them, without a shadow of a doubt, helped us and will continue to help us as we go along. 259 people. It is a lot. And initially, in those COVID days, the death rate was higher than this time last year. Now, we're lower than this time last year. The deaths aren't taking place. We had 9 deaths last week. None of them were COVID. So, on the whole, it's been very trying. I've got to say, I think our carers out in the community that have cared 24/7 for their loved one, be it a son, a daughter, a husband, a wife, grandma, whatever, a neighbour, I've got to say, I can understand what some feel, that they feel that no one's listened to them or they've been forgotten because it's all been care homes, and trying to explain to those individuals that our care home residents are the most vulnerable in society has been very difficult. Rest assured, we don't forget any of our carers. And on the 4th of March, just prior to lockdown, I took a motion to St Helens Council, and that was to government saying the crisis in social care. That crisis has been escalated tenfold with this COVID, and that is no exaggeration at all, because we've got people that weren't ill previously, that have had COVID or have been rushed into hospital, and we've had to put emergency care packages in place to support them. That will be another family caring for someone. Hopefully they will rehabilitate to something like they were before, but we can't say definite. I think mental health, without a shadow of a doubt, it's affected everyone. I think the first couple of weeks, a lot of individuals might have thought, oh, I've got an extra fortnight off work and it's going to be great. I can do this and I can do that. And I think by the end of the second week, 24/7 with a husband or a wife in perfect health has been a trial. So imagine the pressures of looking after someone with needs that hopefully none of us will ever have to cope with. So on the whole, I've got to say it's been the biggest challenge of my life. It's been in politics. It's been the most distressing. It's been the most humbling. And I'll never, ever be able to thank our carers, our volunteers out there, our families that didn't have much to give but donated £1, our pensioners that did the same. I'll never, ever be able to thank them enough. I think community spirit has really been invigorated. We need to seize that. We need to grasp it. We need to make sure it grows, because the financial challenge facing all local authorities, we will need to reduce services. We will need to reconfigure reconfigure how we do things, and it's got to be cost less, it's got to cost less, but it's got to be quality, and it's got to meet the need. So reset and recovery, which all the local authorities are looking at now, we've got to involve the people that are the service users, the carers, and we've got to really embrace the skills of the people out there that have time, be it an hour, be it 2 hours, to really take this forward. And hopefully, a vaccine will come about. I do dread the next couple of months because we've got the flu coming, we've got the inoculations, the vaccines, so all that's got to be arranged, because very few will be going to a doctor's surgery like they used to do, or a clinic, because of social distancing. So it might be done similar to the way the test and trace is going on at the moment. We'll have to wait and see. But what we don't want is for people, and there are these individuals that are still frightened to come out the front door, they're frightened to go to hospital appointments, the dentist. We've got to ensure that everyone that is entitled to the flu vaccination takes it up, because we couldn't cope. Our hospital couldn't cope. Social services couldn't cope with a flu epidemic and a COVID upsurge. So it's still going to be a very, very worrying time. And well, we'll just have to wait and see. But I would say, wherever possible, if you've got any social media, please advertise. If you're over 50, get your flu jab. Get your flu jab. That is the one thing every person can do for us to help us moving forward. And that's it from me.